Epilepsy is a neurological condition which affects the nervous system. Epilepsy is also known as a seizure disorder. It is usually diagnosed after a person has had at least 2 seizures that were not caused by some known medical condition, such as extremely low blood sugar. There are over 15 different types of epilepsy, and all have different causes and symptoms. There are 2 main types of seizure that an epilepsy student will have. Primary generalized seizures begin with a widespread electrical discharge that involves both sides of the brain at once. Hereditary factors are important in many of these seizures. Partial seizures begin with an electrical discharge in one limited area of the brain. Some are related to head injury, brain infection, stroke, or tumor, but in most cases the cause is unknown. Most children living with epilepsy are typical students. They perform well academically and socially. However, those students who are most likely to run into problems at school usually have a more severe form of epilepsy. These students either have severe epileptic syndromes, or their seizures may be associated with other brain conditions such as traumatic head injury, brain infection, or neurodevelopmental disorders. Anti-epilepsy drugs, especially when the student is taking more than one drug, can have adverse side effects on learning. Decreased alertness and attention, slowing of the fine motor skills and mental processing speed, and a variability in mood and behavior are some of the side effects that can affect learning. For some students, having epilepsy can be a misunderstood condition in which teachers, family members, and peers may underestimate the student's ability. Students may be unnecessarily restricted and protected. Seizures can often lead to anxiety or shame. In the classroom, we may see the following symptoms in our students with epilepsy depending on the severity of their condition. Attention and memory can be affected due to the seizures and medication. Students may show an inability to do work at various times. Oftentimes, as these students are able to come off of these medications, they show improvement in the classroom as long as the seizures remain under control. As teachers, there are some modifications that we can implement for these students. First, we must treat these students like the others and also model how to calmly react to the seizure if the epilepsy is severe. If we have students in a lab or shop setting, we must ensure that they are going to remain safe if they are working and have a seizure. Depending on the severity of the epilepsy, we as teachers can make fairly simple modifications to ensure the student feels like he or she is part of our class and putting their condition in the back of their minds as they learn in our classrooms.